millions of lives every day. Look for the symptoms, look for the symptoms. You see the symptoms in any of your loved ones, then get to the doctor right away. Listen, listen, look out for headaches and fever, white spots in your eyes. You must pay attention, look out for the signs. Pale swollen glands or a lack of appetite. Don't waste time, head to the doctor, that could save your child's life. This is the rhythm that gives us life. Pay attention and save a life. This is the rhythm that gives us life. Early detection could save a child's life.
So folks, June is recognized as Brain Health Month, a time to raise awareness about conditions that affect one of the body's most vital organs. While cancer in children is relatively rare, brain tumors are among the most common types of childhood cancers. Here to discuss is consultant pediatrician, director of Bola Health Medical Center, Dr. Oluwatomilayo, got it right?
Yes.
Bewaji Edokpa.
Yes, sir.
Oh, man, clap, you know. Morning, welcome.
Good morning.
Beautiful
Thank
name.
you.
What's the meaning?
It means God is enough joy for me.
God is enough joy for you. It's from what, Nigeria?
Yes, that's
amazing. Correct. Absolutely amazing. I told a story earlier because we were talking about Relay for Life, the cancer fundraiser. And I support them because my mom had cancer. And I remember going one time, and as soon as I got there, they said, boy, these kids want to see. And I said, can I bring my mother? And I didn't kind of want to get involved. You know, sorry about the long story, but they brought about 12 of them, and they all had this sash on. I had a great time with them, and when they walked off, I looked at the lady and I said, why are they wearing a sash? They all had cancer.
Oh, wow.
And these are like 9, 10-year-old kids, and they were pointed to some of them, and we probably lost a number of them by now. I say that to ask the question, how, before we get to the brain tumor, how prevalent is cancer in kids?
Okay. So childhood cancer is relatively uncommon, but it's common enough that we don't want to miss it, especially because early identification makes such a big difference to a child. We have estimates about 50 to 70 children per year in Jamaica will develop some kind of childhood cancer.
50 to 70?
50 to 70 children.
Yeah.
And we find that leukemias are actually the most common, but among solid tumors, brain tumors are actually one of the highest.
Yeah. Are you born with cancer?
So cancer is, you know, there are a lot of myths out there. We have persons thinking maybe it's because of something that they may have done during pregnancy, or maybe something that was done to the child. You know, we have a lot of spiritualists and concerns about someone doing something to the family. But we don't have that direct correlation that is something genetic. In fact, genetic cases are probably less than 5%. And it's not something that you can actually do anything to cause in a child. It's just something that happens spontaneously.
Yeah. I mentioned brain tumor, but I suspect not all tumors are cancerous.
Right. So there are brain tumors that are just taking up space. So a tumor, just to explain, it's just an overgrowth of cells. And so you can have that happening and it becomes, it's cancerous, or it can be benign. But once it's in the brain, because there's only so much space for the brain itself, it still will have significant impact on the child. And then it's also important to know that brain tumors or brain cancers can come from other locations as well. So you may start off with a tumor or a cancer in the brain, but you can also have cancers from other locations in the body that then spread to the brain.
Explain that.
So, for example, bone cancers have a predilection to spread to the brain. In adults as well, there are other cancers that can spread to the brain.
Okay.
So you may find that you see that there's something in the brain, and the question, therefore, that you have to answer is this originally from the brain, or is this originally from some other part of the body, and has it spread to the brain?
We're talking about kids here.
Yes.
And parents are never trained to deal with these things. How I know something going on? Because, you know, kids say, boy, daddy, my head hurt me, and so how I know something going on that would need somebody like you to look at them?
So early warning signs for childhood cancers in general would be if your child is having fevers at nights and we don't know why they're having this fever. If there's unexplained weight loss, you may find that the child bruises easily or just seems to be tired all the time or a bit pale. And then specific to brain cancers, you can find that they have headaches, especially at night or early morning. They may wake up with the headache, it's very severe, and early morning vomiting in association with a headache as well. Some brain cancers can result in a child that's having dizziness or changes in their vision. Sometimes they may become more clumsy, or you might find that they're just stumbling or less coordinated than usual. And at school, the teacher may notice that the child just doesn't seem like themselves, is not focusing as much, is not able to remember as much as before.
Okay. I'm scared of this answer, but a brain tumor is a death sentence?
So not necessarily. What we find with solid tumors is that you can remove them depending on the location, and once you've removed it, then you may need to do chemotherapy, radiation, or some kind of combination of the two. And we find that for malignancies in general in childhood, you can have an 80% cure rate in first world countries, whereas in the third world we're getting a 20% cure rate. So there really is a significant gap that we need to do something about.
Yeah. You said earlier that there are a couple of myths out there, and nobody never do the mother nothing, and she never do nobody nothing. But why? So why would a child have cancer?
Right.
Why? Where does that come from?
So that's something that we're still trying to understand better. There are certain things in the environment that can predispose to malignancies. And then there are, for example, a child may have what we call a retinoblastoma. So they have a white area. When you look at the back of the eyes, you may see the malignancy. Or you take a picture and instead of it being red, you see white in the eye. So these are, malignancies that just seem to occur spontaneously.
Yeah. Not generic?
So there are some genetic malignancies, but it's really not as common.
Not generic. Genetic is the word I want, but you understood.
No worries.
You understood. Wow. So, so the rate, treatment and recovery rate would be about what?
So recovery in our setting is about 20 to 30% of the population, which, the WHO has this global childhood cancer initiative that they've launched for the past couple of years to try to reduce that gap. And you saw the video that we played at the beginning from PAHO. They're also working actively to try and reduce that gap. And one of the things that's been initiated is creating these centers of excellence, which Bustamante Hospital is actually considered one. Also training staff that is specialized in childhood cancer care. So we have a few hematology oncologists that are specific to pediatrics and specialist nurses as well. But we really need more. We have, I think, 3 hematology oncologists. We had one that actually came back recently, which is exciting. And we had a childhood cancer forum on Monday, launched by the Ministry of Health. And at that forum, we realized that we have 2 specialist trained pediatric oncology nurses. So we really need more.
All right. For moms and dads watching and listening, tell them what they should be looking for, or if they see certain things, what they should do. Please.
Right,
Just look in that camera and tell them, please.
So if you're finding that your child is having fever that is unexplained, they seem to be, more weak than usual, they're looking a bit pale to you. If your child is having headaches early in the morning, waking up and vomiting, you find that their personality has changed, they're not able to concentrate as much as usual. If you're just suspicious that something just doesn't feel right about your child, then definitely go to your pediatrician as soon as possible. What we do is we do a series of blood tests. We look to see whether there are changes in the blood count of your child. We can also look to see whether the normal cells are there or whether they're abnormal cells. And specifically for brain tumors, we can do imaging, such as a CT scan or an MRI, depending on what we're looking for.
Tell me quickly about Bola Health.
So Bola Health is a comprehensive medical center. Bola is actually the name of my mom. We started a medical center in her honor when she passed away in 2023. So we launched 1 year to the anniversary of her death.
I'm sorry.
And the beautiful thing about it is this is something she would have been proud of. She's always wanted us to use our varied skills because we have a few doctors in the family, business, dentists. And so we've brought everything together into one medical center where you can come in and you see your GP, you see your pediatrician, you see your dentist. You can come to us even up to 10 p.m. in the night.
Yeah. And you were born in Nigeria, weren't you?
I was born in Nigeria, grew up in Jamaica.
Okay. Beautiful. Consultant pediatrician, director of Bola Health Medical Center. Dr. O. Oluwatomilayo.
Yes.
Bewaji Edokpa.
Yes.
Don't?
Yes,
I got
that's
it
correct.
right. How much people don't get it right at the time?
To be honest, I've had persons start off with the correct name, and then by the time we finish the conversation,
They don't know.
it's something else completely. So you've done very well.
Thanks for coming and well explained.
Yes,
God bless you
very much.
and your family. And sorry about your mom.
Thank you.
10 minutes to your health, folks. We'll do it again next Thursday.